Doctors and health experts say that the United States is facing what they're calling a potential twindemic, two major outbreaks at once. New coronavirus cases are spiking just as the flu season is set to begin. Together, officials warn that they could overwhelm an already strained hospital system. For more on this, let's bring in Dr. Max Cooper. He's an emergency room physician and a Pennsylvania state lead for the Committee to Protect Medicare. Dr. Cooper, great to have you today. Let's get right into it. The flu and COVID have several symptoms in common: fever, chills, headache. So how can people tell the difference?
Well, thank you so much for having me, Lana, and you're exactly right. They have very similar symptoms, and so it's a tricky situation when we're trying to differentiate them in the hospital. Cough, shortness of breath, fevers, body aches, nasal congestion, sore throat, just like you mentioned, are in both. There does seem to be a little bit more predominance of diarrhea in coronavirus, as well as a somewhat unique taste and smell decrease associated with the coronavirus.
And I'm wondering, with what we know right now, and obviously there's a lot of stuff that we're still learning about COVID, can you have the flu and COVID at the same time? And if you do have the flu, does it potentially make you more susceptible to COVID-19?
There's no data that I'm aware of right now that shows if you have the flu, you're protected from COVID. You can certainly have more than one infectious disease at the same time. Absolutely.
And about it potentially making you more susceptible because your immune system is already fighting off the flu?
What we've known about the coronavirus is those who are more predisposed to severe disease, those who have diabetes, those who have hypertension, those who have underlying heart disease, will have a worse course with the coronavirus. So it would make sense that if you have multiple infectious diseases at the same time, you'd have a sicker course. Certainly that's possible.
So why, Dr. Cooper, does the pandemic make it so much more important to get a flu shot this season?
Well, every year there is the flu season, right? It starts in the fall, ends in the spring, and we can somewhat anticipate how many people will get sick. Generally between 12,000 and 60,000 people will die every year of the flu. And every year we try to match the flu strains we anticipate coming to the flu vaccine that we distribute. And every year that meets a certain variable amount of success. Now, every year, we also have people that we hospitalize and we put in the ICU with the flu. And if you add that on top of the anticipated number of people that we will see with coronavirus, you could have a situation where the hospitals get overwhelmed and we won't have the space to take care of people, just like we were in the first wave back in the spring.
Well, speaking of that, the U.S. healthcare system was, in some cases, overwhelmed, in other places nearly overwhelmed when the pandemic started. And that was near the end of the flu season at the beginning of the year. Is our healthcare system now prepared for dealing with a potential surge in COVID cases alongside the flu?
Well, we certainly know a lot more about how to treat COVID. We have a few therapies that are mildly effective. As far as a capacity issue, we're much better off now than we were in the spring. My hospital had to triple and was considering quadrupling the size of our intensive care unit. There was a regional, what we call a field hospital set up at a basketball court where all the kind of additional cases that couldn't be cared for in the hospital were to go. We don't have any of that right now because we've been able to get our numbers better under control. And certainly the same things that are controlling our COVID numbers could help control our flu numbers if we're distancing, if we're wearing a mask. You know, both of these diseases are spread by droplets. And so it makes sense that the things that we do from a public health perspective, like the distancing and the masking, can help minimize the effects of flu season as well. So my hope is that this will be a less severe flu season than in years past because of the COVID containment measures we have in place.
Well, I certainly hope that you're right on that case. Are you worried about other respiratory illnesses right now?
I always worry about other respiratory illnesses. And, you know, everything right now is flu and COVID, and that's what everyone's talking about. That's what everyone, you know, has in their mind. But I had a patient just a few years ago who had, a different type of virus, and there's tons of different viruses that get circulated every year. She was a young, otherwise healthy woman, and she presented to me, and she was short of breath, and she had trouble breathing, and she had a fever, and her heart ended up stopping. And we had to put her on a heart-lung bypass machine, and she ended up in an ICU for a very, very long period of time. Now, she recovered, but she still has lingering symptoms. She has a limp. She can't walk as well as she used to. And so I always worry about other viruses, and I also always worry about long-term sequelae of these illnesses that we might not be thinking about when they talk about the top line numbers of this is how many people die and this is how many people survive. There's a number of people who survive that get very sick as well.
Well, so just top line it for our viewers as we're heading into the flu season. I think that there's a lot of people who in an ordinary year, if they feel like they have a cold or the flu, they would just wait it out at home and not necessarily see a healthcare provider. If you have those symptoms now, Dr. Cooper, what's your advice?
Well, the best advice I can give you is to continue with social distancing measures, continue with masking, wash your hands, and definitely get your flu vaccine this year. If you feel symptoms, call your primary care doctor and discuss whether or not you need to seek care in the emergency department.
Thank you very much, Dr. Max Cooper.
Thanks for having me.